Good evening, guys. Today we are going to do some foreign medical graduate entrance examination questions. So let us begin with which epileptic syndrome is associated with left hemispheric atrophy in a child? A. Dravet syndrome, B. West syndrome, C. Lennox-Gastaut syndrome, D. Dike-Davidson-Mason syndrome. Now, this epileptic syndrome, which is associated with hemispheric atrophy in a child, is Dike-Davidson-Mason syndrome. So the correct option here is this one. A 5-year-old boy has recurrent infections, low platelet count, and a rash as shown below. What is the likely diagnosis? A. Severe combined immunodeficiency. B. Job syndrome. C. Bretton's agammaglobulinemia. And D. Wiskott-Aldrich syndrome. Well, it is Wiskott-Aldrich syndrome. Why it is Wiskott-Aldrich syndrome? Please comment in the comment box. And the correct comment will be pinned up. Which of the following scoring is done to assess respiratory distress in neonates? A. Crib score, B. Apgar score, C. Silverman-Anderson score, and D. SNAP score. Well, it is Silverman-Anderson score. Which of the following genes is implicated in pathogenesis of juvenile myoclonic epilepsy? Is it FMR1, fibrilin1, kinin1, GABRA1? It is GABRA1. True about Fragile X syndrome is a triple nucleate CAG sequence. It is not CH, it is CGG sequence. 10% female carriers are mentally retarded. This is not correct. Males have IQ 20 to 40. Yes, this is correct. Gain of function mutation. No, there is a loss of function mutation. So the correct option here is males have IQ of 20 to 40. C is the correct answer. Which of the following diseases X-ray findings are seen? Yeah, concentrate on the metacarpus. Gaucher's disease, A. Fabry's disease, C. Marquis disease, D. Niemann-Pick disease. It is a Marquis disease. Here you can see rounding of the vertebral body. So it is seen in Marquis disease. In which of the following diseases a skin rash is shown in the figure? Well, it is a Casal's necklace. A. Multiple carboxylase deficiency. B. Biotinidase deficiency. C. Alkaptonuria. D. Hartnum disorder. It is Hartnum disorder. An 8-day-old neonate presents with hypoglycemia and jaundice is diagnosed to have a metabolic disorder. The most likely diagnosis is A. Hypothyroidism, B. Galactosemia, C. Glycogen storage disease, and D. Fatty acid oxidation defect. It is galactosemia. Identify the disease in the child with violet-colored rashes around the eyes and on the hands. Is it juvenile dermatomyositis? Is it systemic lupus erythematosus? Is it Kawasaki disease? Is it Shannon-Sharney purpura? It is Kawasaki disease. Identify the device used in resuscitation. A. Pulse oximeter. It is definitely not a pulse oximeter. B. NIBP monitor. No. C. Defibrillator. D. ETCO2 monitor. It is a defibrillator. You can see the shock pads there. A 2-month-old baby with central cyanosis presents with the following findings on chest X-ray and ECG. What is the most probable underlying diagnosis? A. Tetralogy of Fallot. B. Hypoplastic left heart syndrome. C. Coarctation of aorta. D. Epstein anomaly. Well, it is Epstein anomaly. The skin lesions shown in the picture are seen in which heart disease? Well, they are erythema marginatum. A. Eisenmenger syndrome. B. Rheumatic heart disease. C. Infective endocarditis. D. Heart failure. It is rheumatic heart disease. They are erythema marginatum. The following X-ray picture is seen in which congenital heart disease? A. TGA. B. TAPVC. C. TOP. D. Tricuspid atresia. Well, it is TAPVC. Which congenital heart disease is associated with the child's condition? A. ASD. B. VSD. C. Patent foramen ovale. C. D. Patent ductus arteriosus. It is ASD. Luton-Barr's syndrome comprises of A. Ventriculoseptal defect with aortic stenosis. B. Ruptured sinus of Valsalva. C. Atrial septal defect with mitral stenosis. D. Complete common atrioventricular canal. It is Guillain-Barré syndrome is atrial septal defect with mitral stenosis. Which of the following condition can be given finger is associated with A. Parvo B virus, B. MDS, C. Down syndrome, and D. Fanconi's anemia. It is Fanconi's anemia. The following X-ray finding in the skull is a manifestation of A. AML, B. Hereditary spherocytosis, C. G6PD deficiency, D. Thalassemia. Well, it is thalassemia. You can see hair on end appearance. Identify the nature of this. Here it is a polycystic kidney disease. So let us see the options. A. Renal cell carcinoma, B. Pediatric cyst, C. Polycystic kidney, D. Medullary sponge kidney. It is a polycystic kidney. Maximum urine osmolality in a preterm neonate is A. 200, B. 400, C. 500, D. 800. It is 500. Maximum urine osmolality in a preterm neonate is 500. What is the most common complication of malaria in children? Well, it is severe malarial anemia. It is the most common complication in children. Superior rib notching is seen in all. A. Osteogenesis imperfecta, neurofibromatosis, C. Marfan syndrome, D. Coarctation of Berta. It is coarctation of Berta, where inferior notching of rib is seen. Identify the abnormality given in the peripheral smear. Well, A. Megaloblastic anemia, B. Thalassemia, C. Sickle cell anemia, D. Iron deficiency anemia. It is sickle cell anemia. Poor prognostic indicator of ALL is A. Female sex, B. Leukocyte count less than 50,000 per microliter, C. Age greater than 1 year, D. Hypoplody. It is hypoplody, which is a poor prognostic indicator of ALL.